the clap, you know.
So wait, what does that do?
Wait.
Oh, just so that when you get the video and the audio, it starts at the same time. So it starts at the clap.
Yeah. So now this is the start of the podcast. Yeah. So we have to start with like a clap because I'm using an audio source and a video source that's not together.
Mm-hmm.
If I was using, sometimes if I'm just using my camera with the mic on my camera, it's already synced up.
Yes.
But I started this like 10 seconds before I started that.
Mm-hmm.
And even if we just start them at the same time, it may not be synced up.
Oh, okay.
Yeah.
So you clapped and now it's begun officially.
Yes. Once I clap, it has begun.
What about the second clap? What does that mean?
I just did it twice just to make sure. Yeah, that's where you see some people with those board things, the clipboards, like take 3A.
Take 111.
Yeah. Right, because that reminds me of have you seen the one commercial? The Mutual Liberty. And he's like the dude, I think he might be not on the motorcycle, but he's on like a boat and he keeps messing up his lines. He's like, Liberty, bubbly, boobly, doobly.
No, but I do know that there's what was it? I think like a car insurance commercial or something where they're pretending to be detectives. And then all of a sudden this guy goes like on a tangent about car insurance and she goes, cut. That's not in the script.
I have seen that one. That was another good one.
Yeah, like there were like two detectives or something, and then all of a sudden he just like goes on a tangent about like some sort of car insurance or something, but I don't know which one. So apparently it's not that memorable.
Yeah. I can't remember which company it was either.
Mm-hmm.
But speaking of commercials, my favorite commercial has to be it's for KFC. I forget how it goes, but it's like this is $5. It's like everything's $5. This sandwich is $5. That sandwich is $5. These fries are $5. This is $11.99. I'm just something. He says something funny.
Yeah.
I'm just like, I just got you giblets or something. And then I also like the Arby's commercial. It's like we have for the meats.
I don't know if I have a favorite commercial. I kind of just don't like commercials. When they come on, I mute them because I just want to get back to my show.
Yeah, I have noticed the past like week or two you've been like when you watch Hulu or anything else that has commercials, you just mute them.
I do. So I don't think I have a favorite commercial.
Some commercials are good though. People spend lots of money on the advertising.
Mm-hmm.
You go to the Super Bowl. I think it was like $5 million for 30 seconds at the Super Bowl.
That's insane. I feel like I'm not influenced though by what they advertise.
I do feel. I feel like advertisements don't really make me want to buy the product, but it does. You do get like if it has a good jingle, you do get the jingle in your head.
True. See, for me, it's not an advertisement, but like jingle wise, I watched the bedtime Bible stories.
Oh yeah,
and it's like the little song, and they were talking about like how it gets stuck in your head, like their intro, and I do find myself like singing like da 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 da, and I'm like, oh wait,
she does sing it. I can testify.
It is always stuck in my head.
Yeah. So you may be wondering who we have here today. This is actually I won't even introduce this person. You can introduce yourself.
Hi, I'm Alexis, PAC, as of yesterday.
Can you tell me what that means?
That means I'm a physician assistant that's certified, so I can officially practice medicine.
What type of medicine? Like, what do you mean you can practice medicine? You're going to be behind the counter at like a drugstore giving people the prescriptions?
No, that's a pharmacist or a pharmacist technician. A physician assistant is the hoity-toity term would be a mid-level provider.
Okay.
So in between a doctor and a nurse, you can see them when you go to the doctor's office instead of a doctor. And they take care of you. They do a lot of things. They basically do everything you can think of, but underneath the supervision of a doctor. So we have to send off to them sometimes. Sometimes they double check our work. We can go to them with questions or really anything, but we're pretty independent too.
Yeah. So I think the important part there is you are pretty independent.
Oh,
because it's
totally.
not like you need a doctor to come in and check everything or that you can't do anything by yourself. It's you just have a doctor. You know, a doctor always has to be in the office.
Yeah.
We all know.
Not even, no.
Well, yeah.
You can, when you get to a point, you can be the only be a PA running a clinic, and then the doctor checks in.
Okay.
Once in a while, or at least they're always reachable by phone or email or something. Let's say you came in and I didn't know what to do. I could call my doctor up and he'd be like, okay, either A, do this, or B, I'll be there.
Yeah. Wait, so what made you want to become a physician assistant? And again, it's not assistant to the physician. It's, I don't know why it's exactly called that. Do you know why?
I don't, but there's been a lot of debate about changing the name to physician associate.
Yeah.
Because that
Still
gives
PA.
It's still a PA, yeah, exactly. So I don't have to change any of my jackets or anything or change my name. But it gives it more of an equality to it.
Yeah.
Because when it says physician assistant, it kind of sounds like we're just serving them, or you get their mail or you take their messages. And I'm like, no, I take care of you just like the doctor. It's just that they have to sign off once in a while.
Yeah.
But to become a PA, I always get this question and I always feel like I have to like make up some answer because it's not that exciting as everybody else is.
So why you wanted to become a PA?
Why. Honestly, I wanted to go to school for teaching and then Dad said no. And so senior year of high school I had to figure out something, and Aunt Kim was always talking about her physician assistant, and I took an anatomy class with what is it, Mrs. Fives?
Oh yeah, in high school.
I feel like she changed. She had just got her name changed, or she just changed it.
She just got married?
Yeah, at that time.
Oh, okay. I mean, I know her as Mrs. Fives.
Oh, it is okay. I just want to make sure.
Anatomy teacher, right?
Yes. So I took anatomy with her my senior year, and I loved it.
Which is gross because it's not that anatomy is gross, but they're dissecting. I remember, I think it's like a cow eye or a pig eye.
Oh yeah, there's like intestines and like cows and pigs and everything. But I thought it was really interesting, and then, you know what, Dad telling me, no, you can't be a teacher, and then just always loving medicine because I was such a clumsy child that I've had so many experiences in the hospital, in the ER, at the doctor's office that I always liked medicine too.
Yeah.
And so I was like, yeah, sure, I'll do it. What really got me with being a physician assistant was my sophomore year. I went down to Guatemala on a medical mission trip, and one of the ladies who supervised it, she's actually a physician assistant, and I didn't know it, but she was one of the directors of the program. And I saw her treat in the village scabies, and I was like, wow, like this is the moment that I know like I wanted to really do this.
Is that the thing that pirates get?
No, that's scurvy. That's vitamin C deficiency. Scabies are bed bugs, basically. Ooh. And the problem down in Guatemala is that you can give them like a prescription, but in order to get rid of scabies, you have to dry clean everything. So throw everything into the washer and dry on hot water. And in villages where they're poor, they don't have hot water to really clean it and kill it. So they're getting stuck in the cycle of they keep on getting it. And at that time, it was their baby that had it. So the baby was really fussy and in a lot of pain.
Yeah. Wait, so can it easily be spread to the other people?
Yeah. So if Juliana brought it home one day, the whole house would get it because it's just from person to person, contact sheets.
Money is super important. Make sure you have good savings, all those things. So that would be a good episode.
And to be fair, we really don't have the knowledge or ability to know how to handle our finances. So somebody with a little bit more experience is really perfect.
Yeah, definitely. But I feel like in school, they don't really teach you that. They tell you, make sure you save some of your money, maybe. And I remember in middle school how to do a check. Like, you tell you how to sign out a check.
Yeah.
But they don't actually really teach you how to save, not just put your money in a savings account, but to put your money in a high yield interest account. Either whether that's a savings, or they don't teach you about the stock market or about 401ks or any of those things, or just retirement plans. They just tell you work, save your money, or maybe save it, and then somehow you'll survive. So
we actually like 2 months ago, I think, we had our physician assistant class had a financial advisor come and speak to us over Zoom. And so he kind of walked us through our best bets of where to invest money, how to do insurance, how much money, deductibles, and all of that. It was really helpful. I was really stressed at the time about something else, so I didn't give it my full attention. Yeah. So I'm kind of tempted to email him one day, or maybe even to hire him on and just be like, hey, be my financial advisor. Help me, please. Because he had some really good tips, and honestly, it was really helpful, everything that he had said.
Yeah. Like, do you still have his email? Or?
I took a picture of everything, so I have all his email. I think I have maybe even the original email from him. If not, I could probably find or even reach out to the school and ask them for it.
Yeah. It is great when you have Was that in college?
Yeah, it was in
school?
grad school, so about 2 months ago. It was one of our seminars that he was supposed to come in, but since we're all online.
Yeah, but I definitely think it's good to have like people, whether teachers, anyone, just when they're active in like the field that they like, to always have to rely back on. And especially, I'm not sure if you had any of your like PA teachers or like medical teachers, it's good to have them in the future if maybe if you ever want to switch careers, they may know someone or you switch locations, things like that.
Oh, they told us they keep our emails. They add us on Facebook. They're like, we're going to reach out to you and hunt you down so that you'll precept students in the future. And so we're waiting on that. I'm really close with one of my teachers though, but even like the other ones are like, we will be waiting. And once you're done with your first year of working, you're getting an email and you're definitely going to have to precept.
Yeah. And what is precepting?
Precepting is kind of like, how would I explain it? As a student, you would go in and you kind of shadow what they do and then they teach you how to do everything. So it's kind of like an apprenticeship where you go in as a student, as a PA, and your preceptor is kind of like your boss and they're in charge of you. So you do stuff and then they double check what you do or they'll teach you how to do it. And each place is different. Some places your preceptor just had you shadow. In other places, they might just baby you into actually seeing patients. So you go step by step. And then in other places, they just throw you in and say, hey, it's your first day. Go see room 1 or go see ER Bay 3 or something.
Is that kind of like what you did on rotation or is that different?
Yeah, so no, that's what rotations are. So as on rotations, I'm the preceptee and then I'm with a preceptor. So my little boss.
Wait, so the boss that you're with, do they rotate around different places too, or they're at that place as a preceptor?
No, they're at that place as a preceptor. So if I get set up at X office, then we always know that this P is at that office. And then I go into a different specialty and I have a different preceptor. So there's always a different preceptor for every place that you go to because you're just going to their location.
And how many rotations do you have? Maybe like 10 or so?
We have 10. They're each 5 weeks. And they're all different specialties, except for 2 of them. You always have 2 family med rotations and 2 internal med rotations, except if you do a specialty track.
Okay.
So you might choose to do surgery like that. That's what you want to be your specialty. And so they take 1 family med rotation away and 1 internal med rotation away. And instead, those 2 weeks go into surgery.
Oh, I got you. And if you don't choose surgery, would you still get a surgery rotation? Or
yes, that is a rotation. It's required. So all of you have 8 required rotations, and then those extra 2 are an extra internal med and an extra family med.
Okay. And what was your favorite rotation?
Pediatrics, my first rotation. I requested to have 2 pediatrics rotations, and I got 2 pediatric rotations. But my first one was at the Wright Center. And it was technically a pediatrics rotation, but you saw everybody.
Yeah.
So legally wise, I guess, or if we were really going to put a true label on it, it's a family med rotation, but it was amazing.
Yeah.
I probably got the most pediatrics experience there out of all of my rotations.
And pediatrics is when you're working with kids, right?
Yeah. So anywhere from like birth to 18 or 21, depending on location.
And that's what you want to do as a PA.
Yeah, that's what I want to do. A PAC.
So like, do you call yourself a PA or do you call yourself a PAC?
A PA. You just walk in and I'd be like, hi, my name is Alexis. I'm going to be the PA taking care of you today.
Yeah.
Well, that's more formal for an ER setting. Once I'm in an office, they know who I am after the first meeting because I don't have to walk in every time and reintroduce myself. Yeah. But every time you see a new patient, then you say, hi, I'm Alexis. I'm going to be your PA today.
So you just use PAC to the other college students. Yeah. They might be a PA, but now you're a PAC.
Yeah, so when you're a student, you're a PAS, which is just physician assistant student.
Oh, okay.
And so when I walked in, for example, I always really have to reintroduce myself in the ER to every patient I see because you have such a high turnover rate of patients because it's just one and done.
Yeah.
And so I walk into, room 3 and I'm like, oh, hi, I'm Alexis. I'm a physician assistant student. Okay. So you have to say that you're a student. Is it okay that I take care of you today? Whereas now that I'm a PA with a C at the end, which is certified, I just walk in and I'm like, hi, I'm Alexis. I'm the PA today that will be taking care of you. I don't have to ask permission.
Yeah. And do you want to do emergency room or even surgeries? I don't know if I trust you doing surgeries. Like, I'm sure you might have the knowledge, but I just can't see. I don't know.
I'm not a surgical PA. would prefer not to have a surgical job. It's just right now, I might change my mind. As a PA, I can change my mind whenever.
Yeah.
But I really enjoyed the ER, actually. It's really high paced and it's fast, and those words did not make sense. It's fast paced and it's high intensity. That's what I was trying to say. I'm getting so excited talking about it. And it was actually a really enjoyable experience.
Yeah.
It's intimidating as a student. It was my fourth rotation. So I wasn't a baby, but I was still getting used to everything and being able to put what I learned in the classroom into practice.
Yeah.
But I had really great preceptors, and there was 2 other students there. And so we would go see patients together. We each had separate preceptors, or sometimes we'd be doubled up.
Okay.
But when all 3 of us were there, we would all go and see like everybody's patients. So I would go see Taylor's patients with her. She would come see mine. We'd go see Brooks. And so you would have, 3 PA students splinting you, when in reality, now that I'm a certified PA, it's just me splinting you.
I got you. And without breaking, I think it's called HIPAA or whatever.
It's called HIPAA.
Yeah, without breaking HIPAA, what are some of your favorite experiences from rotations?
So if we're talking about the ER, I had a little girl come in one day, and she was super cute, and she had fallen and had hurt her arm. And I'm looking at her, and I'm definitely thinking to myself, I've seen this little girl before, and I've definitely seen this mother, and I really can't put my finger on it. And she's singing Moana, and I'm like, oh my goodness, I actually just treated this girl's mom the last month in my urgent care rotation. So it was really cool just to like see her in a different setting. And she was the first person I ever splinted, and she was 2. So I did this little itty bitty baby splint on her arm, and she let me take a picture of it. So I have a picture on my phone. And you can always ask permission. You're allowed to take pictures of things.
Yeah.
You really can't share them. Like, I wouldn't post it online, but like just to have, and it's just really with HIPAA, like also asking permission. Like some patients are like, oh yeah, like definitely take a picture of my incision, or you should definitely take a picture of this piece of wood sticking out of my neck or something.
Oh yeah.
Like patients are pretty cool, but yeah, I have a picture of that on my phone because I was like, this is my first time splinting. Can I take a picture to remember this? And they're really understanding most of the time.
So another thing about your rotations, you're telling me about this when you had this rotation, and even last week we're talking about it, the shock therapy or whatever it's called.
Yeah.
Because I don't know how. I want to look more into this. It kind of sounds like torture, honestly. Or yeah. Like, can you explain what the shock therapy is?
So in psychiatry, it was my 5th rotation. So right after my ER rotation, I was with Dr. Berger, and he's the local psychiatrist.
Okay.
And he's really the only psychiatrist. We're really lacking actually in mental health providers in PA. So shout out if anybody wants to go into mental health, definitely become a PA, a psychiatric PA or a psychiatrist or a psychiatric nurse practitioner. It's totally worth it. And part of his practice is that he performs ECT treatment, which off the top of my head, I think it's like I can't think of like the
convulsion
therapy.
Yeah.
And a lot of people have mixed feelings on it, because what it is we put the patient down to sleep. Like if they're getting any other procedure, like your appendix taken out, even like when you get your wisdom teeth taken out, you're sedated.
Yes.
And we put these electrode pads on either one or 2 sides of their head. It depends on like side effect wise how they're tolerating treatment, and they just get a little shock and it'll provoke a seizure. It's just a 2-second shock. It's really quick and easy. It's not like they're there for hours. It's the shock is like boop, and then they start to seize, and it's about a 30 to 90 second seizure. And it's supposed to, I haven't talked about this in a long time, but basically the purpose of it is to break down the depression or the bipolar disorder that the patient has.
Yeah.
It's not a first line therapy. It's more of a like either an add-on therapy or a second line.
Yeah. Because I don't know too much about seizures, but I think they're supposed to, when people do seize, it kind of resets their brain.
It's kind of like a reset of the brain. And so typically patient comes in and let's say they're depressed, because you can use ECT for depression or bipolar. And there is a depression aspect in bipolar disorder.
Yes.
And if, patient X comes in, let's say it's a man, like we'll name him like
Steve.
Steve comes in and he's depressed. We try talk therapy first. And talk therapy is not working. Or is
talk therapy just talking to them?
Yeah, it's what we call like
being a friend,
like a counselor. So like just like you're the therapeutic treatment that we're doing is like talking. So you see a counselor a weekly basis, every other week, once a month, what they agree to. If they're not severe. Now, if they're severe and he's coming in saying, I'm gonna hurt myself, I'm gonna hurt other people, then we have to hospitalize them for their safety, for the safety of somebody else.
Yeah.
There's guidelines on that too. I've had to hospitalize patients, especially because, he might be like, no. But like there's certain lines where you're allowed to hospitalize them for 72 hours, I believe.
If I remember, I had a communications class in college. She was a therapist or like something along the line with that. She would have patients come in, and if they said anything about hurting themselves or hurting anyone else or anything like that, she could not let them leave the room. Like there was either like a button she pressed or a phone call she had made, like without the person knowing. But she had to keep talking to the person until like whoever would be at the door. So there was just someone at the door. So I don't know. Like, I'm not sure exactly sure what happened, but if there's anyone who wanted to hurt themselves, it was like her responsibility to not let them leave because you never know what would happen.
And there's certain levels of that too. Steve might come in and he just says it once, and I'm not overly concerned about it. Like he's not actively suicidal. Like he's not actively homicidal, which is the wanting to hurt other people.
Yeah.
And I might not have to hospitalize him. But we base treatment plans off of how severe it is. So we might try talk therapy first and then an SSRI, which is an antidepressant.
Okay.
The motto is with any medication, start slow and go low. So we really choose the lowest dose and we really pace it because we don't try to push medications. It's really just trying to treat it with the least amount of medication as possible.
Yes.
With the goal of hopefully being able to come off of it at some point. There are some disorders where you can't come off of your medication, similar to diabetes or heart disease or anything.
Yeah.
With some psychiatric disorders, really the psychotic ones where you're more unstable in your mood, you stay on them long term. But with our depressive patient, we tried talk therapy, we tried the antidepressants, and Steve is still very depressed.
Yeah.
It's affecting his life. He's not getting out of bed. He's lost all his friendship. Like, think of like the extreme. Then we consider him for ECT treatment.
Yeah, which I still don't know how I feel. Because I understand that you put the patient like in like you numb their body, put them in like a fake paralyzed lump.
Yes.
And so then while they do seize, they're not in harm of shaking around, hitting
not
their
at
head.
all, yeah.
But again, I guess I just need to learn more about seizures because I'm not sure how I feel about you putting someone into a seizure. And I think normally their body's shaking around, which I don't know exactly why they don't have control of their body.
It's just like the firing of everything. I don't know the exact pathophysiology behind it. Neuro's not my best subject. My good friend Alyssa, that's her subject. But
well, Alyssa, if you want to be on the podcast, I would love to learn more about the ECT training and just even like the brain.
But basically with the seizures, your brain's in control of everything. So when it's kind of sick, your body's doing whatever. Yeah. But it's very safe. And we monitor you. You're watched before and after. If it doesn't go well, we're not going to do it again.
Yeah.
It's a scary thing. Some people agree with it. Some people don't agree with it.
It's definitely a topic, like a subject that needs to have more exposure and more education about.
I have
more
seen
research.
It work, though.
Yes.
I've never seen it. I was telling you about it. I've never seen it have a poor side effect before.
Yeah.
I know I told you that like my one patient had a little bit of amnesia, but his depression was gone.
Yeah.
So with ECT, we're really worried about memory loss.
Yes.
But I've seen it work well. I told you I had a patient and he was severely depressed, suicidal. Like he was such a smart boy too. And his depression was really inhibiting him and nothing worked for him. And it broke him a little bit into sunlight. Not a lot. He still had a long way to go, but I've seen it work. I'm not saying every patient needs it, but I'm saying it's a good tool to have.
Yeah. I'm not sure for any legal things or anything. These are all made up scenarios. I don't know. We're just made up scenarios. Steve is not real.
Yeah, Steve isn't real.
This patient that she had isn't real. She was playing a virtual game.
Exactly.
Yeah. You never know. People these days are like sue crazy, money crazy. Even though we're just brother and sister having a conversation talking about like topics. You never know. People out there.
No, this is all make
You're all made
make
up.
pretend and from books I've read and stuff. You know, we do have patient cases that we're allowed to talk about and write about.
Yeah, for a lot of books I know where they have examples. Here's patient Jessie, and she had all these things. And one time we gave Jessie the shock therapy, and she got amnesia.
Yeah.
And that's who we're talking about.
Yeah, exactly.
Yeah.
Exactly.
And do you have any bad experiences from your rotations or anything or any areas that you think they could improve on?
With any rotation that you do, with any job that you have, anything in life, you're going to have people that you don't mesh with all the time.
Yes.
And the hard thing about being on rotations is that the other students in your class go through the same one. So you might have a preceptor that really liked the student before you and that's all they talk about. And so you feel inadequate compared to them. You might have a rotation where you're not as hands-on and so you're bored, or you find that the rotation's just not organized well. Like, you know, you need to get in and you need to be able to do this procedure so many times and you just don't have the opportunity to do so.
Yeah.
But I've never had a rotation that I've hated. I've definitely dreaded it sometimes, you know, going into surgery. It scares me and I'm like, oh, and it was a harder rotation to do. But I found things I liked about it. And that's really the goal, is to find one thing you like about every rotation. And so for my surgery rotation, it was a trauma surgery rotation. So while I did not like the surgery, I actually really enjoyed being in the trauma bay.
Yeah, in the trauma bay, you get more severe injuries.
And they really weren't that severe, though. So maybe that's why. It's like it wasn't like as scary as what I thought it was going to be.
Yeah, if it would be super scary if, let's say, someone was in a car accident and they hit a pole and then they got like something through their chest.
Yeah.
Like, you might just see that in like the TV shows.
Yeah.
Was it hard to get all your requirements for your rotation, especially for what happened with COVID-19? And like, how did that affect your rotation experience?
I was able to get most of my requirements done before everything hit. I just had a rotation where it made it hard to get my certain requirements. And so I was lacking in that certain, we call it a competency. I didn't get that competency, but we were able to do it online and fix it. But really, it didn't affect me too much. I guess if anything, it just cut my OBGYN rotation short, which made me sad because I was only there for about a week and a half. So I didn't get to deliver babies, go into C-section. So I'm really upset that I missed that experience.
Yeah, that does stink. It would be nice to have the experience and just to at least do it once.
But I mean, if anything, I could always, you know, get a job in women's health and see how I like it. You know, my friend really enjoyed it and I enjoyed what I did have. So it's an option. But I mean, moving things online didn't make much of a difference. It was towards the end of our learning experiences. We saw virtual patients online. We read articles. We did quizzes. So really at that point, the whole point of everything was to prep us for our boards, which are called the PANS anyway. So I didn't see it being a big deal.
And you just took that board test, I think it was a week ago today?
Today, Friday? Yeah, 1 week ago today.
Yeah. How was the boards? Like, what are the boards?
So in order to become a PA, you have to pass boards similar to how doctors have to pass their MCATs, their boards to be a doctor. Yeah. We have to pass our PANCE. It's PANCE, so Physician Assistant National Certification Exam.
Okay.
I'm pretty sure that's what it stands for. That's what I tell everybody.
It sounds right.
But I took it last Friday and it was the scariest thing I've ever done. You know, you're prepped to do this. When you take your tests, I like to say the word bred. I know it sounds like a dog, but you know, you're conditioned to learn how to do something, whether that's, you know, you're learning how to do a podcast, like you're taught how to do something. And so, you know, it's a minute a question. You're learning how to cut out answers, how to pick out what's important. And so I felt prepared in that sense. But just taking a 300 question test in 5 hours, you know, being tired and hungry, and then you get to sections where you feel like you know nothing. And I had 2 sections in a row. So 120 questions where I knew nothing. And so I'm like panicking afterwards. I'm like, oh my goodness. But I passed. I found out yesterday. It was the best day ever.
Congratulations.
I was so happy. Thank you.
Yeah, I'm proud.
Thank you.
How were the seats when you were taking the test? I know for me, I need to be comfortable, especially if it's a 5-hour test. I don't want an uncomfortable seat or like a noise in the room, things like that.
It could have been better. It was more of like old school. No, I don't want to say old school desks, but definitely like a laptop desk. Yeah. With a swirly chair, I guess you would call it.
Okay.
it was very low, and because you could pull out the keyboard, there was a lot of distance. I would always have to push it in. It was okay though. It wasn't the worst thing ever.
Yeah.
But I'm used to sitting for long periods of time. So.
Yeah, if I remember you saying even in grad school, I think it was your first year of grad school, what's the name of that called again?
Didactic.
Yeah, I remember during your didactic year.
Yeah.
You had one classroom, you were there the whole day, and the teachers switched out, but same seat, same person next to you.
Yep.
Same everything. I would not enjoy that.
That was intense. You get really sick of for 12 months. You get really sick of sitting. You get annoyed by everybody. It's just it's intense.
Did you build good relationships though with your classmates?
Oh, for most of them, yeah. I definitely have a few like really close friends.
Yeah.
Whatever you want to call it, like best friends, little gang, whatever.
Yeah. You got your little squad with you.
Exactly, yeah. And then you have like more casual friendships. And then you just have people that I'm happy that my 2 years are over. I don't have to,
There's always going to be people who you like in life. And
I was going to say, yeah, like you,
like a little less.
I don't have bad feelings against anyone, but.
Yeah, which is good.
I have my friends and I'm happy to have my friends, but I'm also happy just to move on with stuff because, it's a year of seeing everybody every day. So you get sick of everybody. You're like, I just saw your face for 10 hours yesterday. Yeah. I don't want to see you today.
Yeah, well, at least it's over with.
Yeah.
But some of my fans might be going into a PA.
Yeah.
Or some, they might be going into a situation like this. Do you have any tips for going into didactic year or for
So if you're going
surviving?
Into grad school or really any sort of medical school, so PA school, NP, pre-med, I really can't speak for the latter two, so everything I'm going to say is really projected towards physician assistants. If you're starting didactic year, if you know people, definitely sit by them if you want to. It's okay to sit by your friends that you know, but don't be afraid to sit next to somebody new. We have the first week as introduction week, so icebreakers, getting to know each other, so definitely take the advantage of that. We got to switch seats every semester, so you have 3 semesters.
Okay.
Which is like 4 months each because it's a whole year. So if you don't like somebody, move. But, sit where you're comfortable. Sit where you're not going to be too distracted. I mean, from where I was sitting, I definitely could see out. We don't have windows, but like the door with the windows, like I definitely would be like, oh yeah, I know you're talking over here, but who's walking into the room or whatever.
Yeah, that thing didn't have windows. I hate when classrooms don't have windows.
We've been protesting for that. Yeah. But really, the way the room is set up, it's not like you could really look into a window anyway. Because if anything, it would just be behind you, and then what are you just gonna listen to you talk and me do that the whole time?
Yeah.
Like you're not gonna hear or like see anything.
No. Also, while I'm going through school, I hate when I dislike when teachers say you can't use your phone. It's not like I'm going to be on my phone, but if we pay to go to these classes and it's like our money, and if someone doesn't want to pay attention and be on their phone, I think they should be allowed to. Or if I want to be on my phone and like text someone, I think they should be allowed to. Like, could you be on your phone?
No, they were. I don't want to say they were strict on it, but it's so disrespectful. It might not bother you, but if I'm sitting next to you and I see that you're on the phone the whole time, like you're distracting me.
Yeah, I can see it more in the classroom you were in was smaller. But I'm thinking a lot of my classes, I go to a decent sized school. I might have like a huge class with like 1,000 seats in it, and I mean there might be a couple people next to me, but I don't know. I don't think, at least for me, I don't get distracted if someone's on their phone. Because if not, it's the same as someone being on their computer. I see there's a lot of, when the teacher turns off the lights, if they turn it off for like a PowerPoint or something, you see all the bright screens from the laptops.
I think for me though, I definitely have a touch of ADHD.
Yeah. So
it is hard for me to pay attention. So when I know that we're all on our phones at some point, I have a Mac, so I definitely would text, on my Mac in the middle of class. Nothing like crazy, but if somebody made a comment, or we had a lot of inside jokes like as the year went on. So for example, there's this thing called Cafe Olay spots, and so we'd be like Cafe Olay. And so every time like somebody would say it, we'd go in our group chat and like do like the little like clapping emoji.
Yeah.
Or like just like questions back and forth, like, did you catch that? Oh, can you record this, or can you send me your notes? But then I know like people would definitely just be like not paying attention. And so I definitely would get distracted, on people who would sit in front of me or next to me. I just think being on your phone or not paying attention is rude to the person teaching.
Yeah.
Like, they're coming in, and especially for our adjuncts, those who are PAs 90% of the time and are taking that hour or two to come in to teach you about their specialty and what they work in.
Yeah. It is good to be respectful to those people. But along with the phones, this is more like a high school thing, middle school, like that type of school. But no gum. Like saying when people say, the teacher would say you can't chew gum.
Oh, all we did was eat in class.
Yeah, like I'm not a big gum chewer. I am a big snack. I do like eating.
Mm-hmm.
Food's amazing. But it's weird. I never understood the no gum rule.
I think it's more of like a chewing thing maybe, or just really when you're done with your gum, where is it ending up? It's ending up underneath your chair or underneath the seat.
Yeah.
So I guess I understand that. But no, we ate. I would always break out something and eat. I probably made so much noise with like the goldfish that I ate, or it was never anything crazy though.
Yeah.
Like you definitely don't like pull out a hoagie in the middle of class, but
I don't know. No. Especially I have a lot of being a film major. I have a lot of night classes. It seems like all the film classes are at night, which I hate because some of them go to 8. Maybe they let you out a couple minutes early, but so far 2 of my film classes went till 9:20 at night.
Yes.
I go to sleep at 10 o'clock.
Yes.
Like, I'm not with this going to 9:20 at night. I'm not paying attention. Like, I'm trying to pay attention, but it's hard to pay attention. It's hard to focus. I'm tired. But I would, since they start at 5:30, sometimes maybe I would eat before, but not usually. But I would make a whole spread of dinner and bring it with me. And that is, I guess it is a slightly different scenario. We have like a night class, but even for like any class, I might pull out a hoagie. I might have a whole spread in front of me, put my drink over here. Man, I might need 3 desks. I need over here, I need my drinks, my work over here, my hoagie over here.
Well, the problem with it is that you don't have the room to take up that much space.
Yeah.
That chair next to you, that's where your next person is. So you have like your little designation. And plus we had lunch break from 12 to 1. So everybody went out and ate from 12 to 1. And then luckily we didn't have too many night classes. I think our latest one was OB, which was from 6 to 8.
Yeah.
So you did have the choice. I think we got done at 4. You did have the choice to go home for 2 hours and eat something, or run out for dinner, or go down to somewhere on campus to eat.
Yeah.
But most of us snacked in class. Some of the teachers brought candy, so we'd eat candy in class. That was always the best day.
To stay on the topic of school, do you remember St. Vincent's?
Yes.
So this is getting towards the end of our discussion, and something I want to talk about and bring up real quick. But it's missed opportunities and not taking advantage of opportunities because maybe you're scared or maybe things like that. And this is no fault of our own. This isn't a missed opportunity because we chose not to do it. Mm-hmm. But so St. Vincent's was a school. It went from K to 8th grade. Yeah. And at 8th grade, at the end of the year, schools have field days.
Yeah.
In 8th grade, the 8th graders, they're graduating. Yeah. And they got to go down this like slip and slide.
Yeah.
And so St. Vincent's had this huge hill on the backside, and there's like a field at the bottom, like a playground.
Yeah.
And the 8th graders got to go down a slip and slide. I didn't make it to 8th grade there, nor you.
Yeah.
And I remember every field day, I was like, yo, I can't wait.
They had the best field day too, though. Like for such a small school, it was amazing.
Yeah.
I think what we should do is go get a truck and go slip and sliding.
I am so down to go slip and sliding.
And they have the best
on a hill, though. On a hill.
Yeah, on a hill.
Yeah, because I see people try to go flat. You're not going far. People have to put dish soap on it and things like that.
Yeah.
So you get a hill. Then you put the dish soap on it, and then you go flying down.
We're just going to have to get something to pad the bottom.
Yes.
Maybe like a pool or something.
Next time we're on, maybe if you want, we talk about St. Vincent's. I have a lot of cool stories from there. I think it was cool. Remember, one day was like I feel like there's a lot of themed days.
Yeah, totally.
Or things like that. And one was like a knight day or medieval, it must have been.
Yeah.
And I might still have my shield somewhere. We made a shield and put like designs on it.
I know, I remember. I think we did we do? I feel like we did like a science day or something.
Yeah.
And each classroom was something different. And I remember it was like the human body the one year, and it was so cool.
Yeah, I do. It was a fun school.
Lots of memories. School. They always said they had the best food. Probably because it was a private school, and so like you had like gourmet. I don't want to say gourmet food, but like there was never a bad lunch.
So I don't exactly remember the food, but what I do remember is they had the little square cartons, and you can get like iced tea, lemonade. I mean, they also had like apple juice.
Yeah.
And the crazy part is, the cool part was, it was lunch. Roll back the curtain, and it's the gym.
Exactly, yeah.
No, I remember. I guess a lot of elementary schools, they do have, maybe they bring in like a speaker, like a person who does yo-yo magic tricks.
Yeah.
But I still remember I remember there was a yo-yo person there, cowboy person with like rope.
Yeah.
All these things.
They always had something cool happening. I know they had a field trip down to the Scranton Cultural Center the one day, and I can't remember what was put on, but it was like this weird, a good play, but I was thinking about it the other day, just like that weird trip we took down, and I was like, wow.
Yeah. Something I also liked about the school was we took 2 school buses to get there. We took the one, and we had to hop on, took the one to the school districts that we were at, then at that school district, we hopped on a different bus, and it would take us to the next town over to go to our school. But I liked it because we're getting like an hour less of education a day. Like, I'm not sure what time school started, but
then remember the first week of the school year, Paw Pack wasn't open.
Oh yes.
And so we'd have like a private van come pick us up at the house. Like they'd have to come to your house and pick you up.
Yeah.
And then bring you.
So back to the missed opportunities, things like that. I think a lot of people miss opportunities maybe because they're scared or things like that. Like whether it's like a school dance, maybe they don't go to prom, maybe they're in an organization, or maybe they don't even go to the organizational meeting, or they don't get the leadership position they want. They're scared, not of change, but
failure in a way.
Yeah, they're just of being uncomfortable.
Yes, I totally understand.
A lot of people, it's hard to get out your comfort zone, and that's for everything. Whether it's you want to go to a new state, to try out, maybe like a new job. Especially now when you're young, you want to do things like that.
Yeah.
But missed opportunity. So I'm not sure when the video just cut out, but if it is, you guys just saw a black screen. We're back now. But my challenge for you guys is to say yes this week. No matter like what it is, say yes. Go out your comfort zone. Don't miss the opportunity, whatever it is. Whether your family asks you to go on a walk, whether it's maybe you're in school, maybe you're in summer school right now, and you have a group project, and like take the initiative to be the leader of it, or just take charge. Just whatever opportunities you have, do it this week, because later on, like some things you don't regret, but a lot of things you might regret. Like I said, maybe it's not going to like a dance, or you're in a school organization, or not going to an organization, not joining like an athletic team, things like that.
Yeah.
And it's good not to just experience it. So this week, say yes. Anything else you want to say, Alexis?
No, I think you pretty much summed it all up.
Yeah, I think you did a great job today.
You.
Like I'm so excited. I'm like shaking my legs and I keep moving around because I'm super excited to be like podcasting, having conversations.
Yeah.
And I know they suck. They probably suck. You did great though. But like we try hard to make it look good.
You're just gonna do it just for you. This is just for you. It isn't for whoever is gonna come watch it.
Yeah. And yeah, exactly.
I mean, it'd be great if people watch it, but
other than family,
you can't. You can't do it to please the world.
I know eventually, hopefully, I'll get. Yeah, I know eventually, hopefully, I'll get some fans. It's not that I'm looking forward to fans, but I am looking forward to. I want to add value to people's lives.
Yeah.
Whether it's like entertainment, just 2 friends talking, or a family talking, or it's something. We'll have like some episodes that are more deep and more about maybe like change, like how to change the world, things like that. And I just want to add value to people's lives by entertainment or education.
Oh yeah, it sounds like a good thing.
Yeah. So thank you for being on. I hope you do come back.
I will be back.
Let me know down in the comments if you want her to come back. If there's any other questions you have for, what's your name?
Alexis.
Alexis, that's my sister. That's all I have for today. Thank you, PAC Alexis, for coming on.
Thank you for having me, Chris.
Thank you.
After name.
And as always, well, I already forgot my outro thing I was gonna do. Oh, as always, I'm off the scene.